the UK, broadcasting around the world. You're listening to the Mic Drop Club, hosted by Douglas Hammondisha. Message received. You do not need to know what you need. Just engage with the podcast feed. Providing weekly insights into cool stuff we've read, saw, did, or heard about what made us say, wow, eureka, damn, nothing is off limits. If it motivates and inspires you to reach your goals, then it shall be discussed. Featuring guest interviews from high performers and people of influence, and weekly awards for the best mic drop moment. This podcast is guaranteed to leave you pumped up for the week ahead. Don't just live life. Make life boom.
How you guys doing out there? I hope you're having a fantastic bank holiday Monday. Today I would like to share the floor, or should I say the podcast, with Dr. Cyrus Abbasian, who is a consultant psychiatrist. So he has been putting out some great content on his YouTube channel, which I'll give you access to his feed after the show, and everything's going to be on the show notes in regards to the effects of coronavirus around the socio-economic factors and also our health and well-being. As a consultant psychiatrist, he is well placed to discuss and share with you what it's like not only on the front line, but the wider, broader challenges that we need to be prepared for in order to keep ourselves mentally in top shape and also keep ourselves positive, because let's be honest, this has been a very challenging time for the whole of humanity. It's a global crisis, and sometimes we can get caught up in the noise and thinking it's all about just us. This is a global pandemic. So first and foremost, I'd like to thank Dr. Cyrus for coming on the show. So Dr. Cyrus, how are you, sir?
Good. Thank you so much for having me. I'm enjoying my bank holiday Monday at home.
Oh, fantastic. Did you get up to anything?
Busy in lockdown.
So how are you keeping so busy in lockdown? What sort of things are you doing to keep yourself in top mental health and just your general health and well-being? What kind of stuff are you doing?
As you see, I've actually shaved this morning, which is, it's a good start to the week.
Yeah.
It's important to have a routine, and it's important not to abandon a weekly and daily structure. It's important to get up in the morning on time, to plan ahead as much as possible, and use the technology that we have. Just do a full day's work.
Sure.
I'm lucky in some ways because as a psychiatrist, a lot of what I do involves talking and communicating with patients. And so I've been calling my patients. We've been having telephone consultations. Also, be using Skype and FaceTime to have consultations with our patients.
Yeah.
And sort of the team meetings. I mean, you're a psychiatrist, you're a mental health professional yourself. A lot of what we do depends on teams. We work in teams, and teams have to function. We're using Zoom and also increasingly Teams, Microsoft Teams,
yes,
to communicate with each other.
Yeah, I find that fantastic.
We have adapted. I think it's working reasonably well. If the technology is running smoothly, if you have internet access, then you can get the work done.
Yeah, you just said that if you have internet access, which I think is key. And prior to the coronavirus, there were studies in terms of how many people have access to broadband at a decent speed. And in fact, that was one of the campaign strategies by the opposition in terms of trying to get more votes. We give you free access to broadband. So it is known prior to coronavirus that accessing decent speeds in broadband is not consistent across the country. There are pockets whereby you cannot get access to any decent speed to operate Microsoft Teams, Zoom, Skype, and all those types of things. So it's important for us to also frame that in mind, whereby working from home might not really be feasible in some areas because the connectivity is still so bad.
Yes, absolutely. I mean, you can't use technology if you don't have the technology.
Exactly.
And connect. There's a lot of talk about social distancing.
Yes.
And I don't think we're socially distant. We should be physically distant from each other. But socially, we should be connected with the technology that we have.
Oh, no, that's a strong point. That's a strong point. Yeah, we're physically distant. I totally subscribe to that, but we should still be socially connected. Yeah, I really, really, really like that. And I understand that some hospitals actually communicate via walkie-talkies where they've had problems with connectivity. So I would like to thank everybody in the healthcare professions for being so enterprising and resourceful, particularly in time of crisis, to think very creatively in terms of how best can you still remain contact, keep those teams engaged, and also I'll reach out to patients. I was familiar with quite a few conversations within the health informatics space in regards to Skype, because Skype has been one of those things, again, pre-coronavirus, having video consultations has always been one that flags up IG concerns within health. It always has. And some trusts have been more forward thinking, but the whole issue about confidentiality, who has access to the feed, all of these things have always been the stumbling block. But I see this now has been the tipping point in terms of coronavirus, that we need to communicate with IG.
Absolutely.
Yeah.
There's a lot of red tape in the NHS, as you know.
Yes.
There's so many policies and everything's really slow and they're slow to change. And a lot of it is irrelevant. I mean, confidentiality is important. But it's a very conservative institution, the NHS, really slow to change. And they've been forced to change because of what is happening right now.
Yeah.
And at the end of the day, they had to adapt, and they're adapting.
Yeah, good. And I think I can completely second what you're saying there. I remember conversations about Babylon Health and how it was being received in terms of having these online mobile consultations to doctors and all of that. Thinking whether or not they were cherry picking their patients or not. But the fact of the matter is they were adding great value in terms of engaging people that do not need to go directly to the GP and create a bottleneck within that GP practice by engaging with the patient on their own terms. And this is what mobile and digital technology can enable you to. I had a conversation with one of my co-hosts yesterday regarding the religious aspect of what's happening here. And the religious institutions are not in any way immune to the byproduct of the coronavirus in terms of the physical distancing. So how do you still communicate with people? And some of these institutions are very much conservative, just like the NHS has been, but then now they're having to reach out, do online services, all of that kind of thing. So I think everybody now is riding that wave, as it were, of welcoming a more appropriate solution to the challenges ahead, and that's using digital technology effectively. The right technology will enable you to communicate. So I wanted you to actually share with us some of that rich data that you are expressing in terms of within mental health, which is very much affects people who are from socially economically deprived neighborhoods. What sort of things are we bracing ourselves for in terms of mental health services? Because I know all our services has been focused on the acute front door. Who's going in A&E, get them treated. But in terms of the mental health, which is the far more hidden, and you did allude to it in your last video in terms of issues such as domestic violence, all these things can be the byproducts. Are we bracing ourselves for something that's going to come after the lockdown is lifted?
There is a link between the economy and the health. I mean, this has been established. There's a correlation between the two. And how well the economy of the country is doing affects the health and well-being, both mental and physical health of individuals in that society.
Yes.
Now, there are many studies showing that people who are unemployed, the people who are less advantaged, the poor in particular, they do badly. Now, the economic impact of what's happening right now will be significant. And one worry we have, a lot of health professionals, is that the reaction right now, which to a large degree is appropriate, we are fighting coronavirus.
Yes.
But the byproduct, the secondary effect of it, will become fully manifest in months, perhaps years. And we know that when there's a recession, there is increase in alcohol dependency, there's increase in mental health issues, there's increase in suicide, and there's increase in many health conditions as well.
Sure.
And the UK will rely on the National Health Service, which is it's funded by the taxpayer. It's a percentage of the GDP of the country. Now, we all disagree regarding what that percentage should be. Most health professionals believe it should be higher. But even if you increase that percentage and the economy does badly, the GDP goes down, there's less money going into the health sector, there are less hospitals being built, and there's less teams set up to deal with sort of the mental health outcomes of what's happening right now. So the effect could be direct because of what's happening in the economy. Sorry, indirect because of what's happening in the economy, and also direct because of the anxiety, the trauma caused on the news. I mean, you just turn the TV on, you're just being bombarded with stuff about coronavirus, and they're interviewing patients who've survived, interviewing relatives. Always, how horrible, how terrible it is.
Yes, indeed.
And that can affect the health and well-being of individuals. Because what I tell my patients is that you have to think positively. You need to do a daily exercise, try and watch comedy, try and keep yourself occupied, and spend maybe 15 minutes to half an hour just watching the news. Make sure you know what's happening. But for the rest of your life, try and live as normally as possible.
I think that's key because I think that's key because limiting the amount of access to news is important, but also making sure you do furnish yourself with the facts, because there's a lot, particularly on more closed like WhatsApp groups, there's a lot of misinformation also being spread out, which can be very, very damaging in terms of the way people...
There's a lot of nonsense, a lot of fake news. I mean, it's just terrible, some of the stuff there. It's just immoral, unethical to put these things out. And unfortunately, some people believe in it.
Yeah. This is a wrong time for that. And I think that the law should come down on them very heavily because they are accountable. Yeah. People know now enough about Twitter, Instagram, Facebook, WhatsApp to know that they are responsible for the information they put out, because misleading the public puts other people at risk, and that can never be good. That can never be right and exact. You shouldn't do that. I remember, I think the worst thing I ever heard regarding this whole coronavirus, the worst thing I absolutely heard was something came to me on my WhatsApp feed regarding an issue saying Black and ethnic minority groups shouldn't worry about coronavirus. This was just probably the first week it really hit the UK. There was no cases at the moment back from Africa and other developing countries at all. There was nothing at all. So this came through. And I was like, are they serious? This is the most stupid statement you could even share in one broadcast. Why would you do that? And as you rightfully said, health inequalities are real things. And as we're seeing now from the statistics coming out of New York itself, the greatest percentage of people being affected by those are people who don't have access to healthcare, don't have access to decent jobs, decent sanitation, decent housing. And guess what? A lot of them are ethnic minorities. So that's been debunked in 3 weeks based upon data coming back. But it's taken 3 weeks for the data to surface and get through the system. So I'm really, really want to put out there, anyone put out information that is not ground in the science, that you cannot evidence, please just don't do it, because what we need now is solidarity. What we need now is real information that adds value to people's life, that can keep them safe and their loved ones safe. So in terms of mental health, as you're talking about the deep plunge, the spike has yet to come, because we've been fighting the acute side of things here. And there's going to be many people that have never been unemployed before because their skills didn't warrant appraisal, because coronavirus has not hit, because maybe you're doing a job where you physically have to be in a shop. So, and they've always worked. So you got, I think, a large percentage of people that are going to be new mental health patients, clients, service users coming to the system, whereby years of underfunding, there's not been many clinicians in the first place to manage. Certainly when I qualified as a nurse, 2003, I can't remember. We had more specialist services, drug and alcohol were kind of like separate. You know, we had then older people services, CAMS, learning disabilities. There was a lot more separate services to dealing with different types of presentations that a person can present with.
So we're just coming out of 10 years of austerity. And I mean, I'm not quite sure what the government will do after this. Will they have austerity on steroids for another 10 years? I mean, there will be nothing left in the NHS. Yeah. So one reason that we're not as prepared as we should be right now to fight coronavirus is because of 10 years of austerity.
Yeah.
I know a lot of really good staff, very good doctors and nurses who resigned. They left. They had enough. And now the government is desperate for them to come back again.
Yeah.
They're trying to encourage nurses and doctors who have retired in the past 5 years to come back to work again.
Yeah.
Because there's a shortage. At the end of the day, you know, doctors and nurses, they need to get paid. If you don't pay them enough, they'll go. They go to the private sector. They'll go to a different country. You know, they're not going to work for cheap. They're not going to work for free.
No.
So that investment is really crucial.
Yeah.
And I mean, when I was training as a psychiatrist, it's going back, you know, 20 years. There was a lot of money poured into the NHS by the then Labour government. And a lot of new teams were set up. We had beds. We had psychiatric beds then.
Yeah.
And we could really easily admit someone. Now there's a waiting list to get really sick mental health patients to be admitted to a psychiatric or for treatment.
I totally agree with you, because I would have liked to see over the last 20 years better outcomes, better quantifiable, measurable outcomes. And I don't see that because of this whole revolving door because to get admitted right now into a mental health bed is so difficult. You got to be so unwell. The metrics they use to get you back into the community, the baseline is so low, and it's normally measured by how much in adherence are you to medication or behavioral factors. You're quiet, you're settled, you're not causing any problems on the ward, and you take the medication as prescribed. Then you go. Then we say that's a success. Patient is being discharged. But we've never demonstrated with all the technology, with all the new wards that were built, any way whereby we could demonstrate that this patient came in and we enhanced their ability to self-manage. We enhanced their ability to take better control of their health decisions, so that by the time they left, they were fully capable of taking their medication independently and they knew the reasons why they take the medication. We're still working on very much on the behavioral. They've conformed to the rules and regulations, so they're going back home, and guess what? They come back. And that I think that is to do with what you were talking about before, the 10 years of austerity, the cutbacks. So a lot of talented individuals who are really at the forefront of patient empowerment, embracing the recovery model, they're not there anymore. So
I mean, I can tell you as a consultant psychiatrist, I can quite easily move to the private sector, and I can almost double my salary overnight. There are a lot of jobs there for me in the private sector. And as well as doubling my salary, there'll be benefits associated with it. The hours will be less. I'll get, I could get a company car. I could get other expenses. I could also get health insurance. So and if you put too much pressure on NHS staff, because at the end of the day, NHS is made up by the staff.
Yes.
It's the staff that make a team run. If you dumb down the service by not paying enough, by not having enough resources, the staff leave. Simple as that. You can't force them to work for the NHS.
Yeah.
And then you get a situation whereby the system struggles when there's a pandemic.
And it's a question of ownership now. You know, I think you're alluding to it now. When I was working frontline on the wards, I worked directly for the NHS. There was a time when obviously you go to agency and you do half and half, you know, for more shifts. But if you look at it now, agencies control most of the staff within the NHS, whether you're a doctor, whether you're a nurse. So these nurses and doctors that are being trained now, who owns them eventually is going to be based upon not the NHS. They're going to be working for an agency that can capitalize on their own monetary gains as well, opposed to the NHS, because I don't think the NHS has the mechanisms, the support, the benefits in place to enable people to work in a very modern way, as we're seeing right now, working from home, having the ability to have compassionate leave when you need it, really. The things that you need are not in place within the NHS. You're very much deemed, like, I remember going to work and I was physically not well. No, I was not in the right shape of to go to work at all, but the obligation for me to work was so high, you end up going to work anyway, and you end up putting yourself at risk, because if there's a serious or untoward incident that happened on your shift, the NHS doesn't really care that you are not in the fit state, because they'll say you shouldn't have come to work anyway, but the pressure for you to still go to work was there as well. So I just believe that there needs to be a lot more money pumped into NHS in terms of, so that they can actually be confident in holding on to the staff. So the staff actually work for the NHS, and there's a greater incentive, similar to whereby there's incentive for people to get a job opposed to claim benefits. There's that incentive the government's put in place that you get more money if you go to work because we're reducing the benefit payouts anyway. They don't really do that in the NHS. They're still left in this situation, as you quite rightly explaining. You could, right this minute, you could go to the private sector and double up. You know, then they need to pump real money into the NHS so that they can retain staff. It's not going to be based upon goodwill. We're seeing competent doctors and nurses dying right now on the front line, putting their families at risk to save lives.
And this issue that we've been hearing a lot, PPEs, personal protective equipment, it really should be a non-issue.
Yeah.
We shouldn't be debating the fact that there aren't enough PPEs going around.
Yeah.
I mean, you don't send your soldiers into battle without boots and helmets, do you?
No, you don't.
You give them the resources they need. They're not front line. They could potentially die for their country, but they need to have the resources and the equipment.
Yeah.
Similarly, our doctors and nurses, our frontline staff are fighting this virus. They need to have the equipment to keep them safe. Because my next video is going to be on mental health effects on staff. And it's really significant. Again, in psychiatry, we're not quite front line, although the government may send us to work in A&E departments if things go downhill. But I hear a lot from my colleagues who are just really, really struggling. They feel anxious at work. They're fearful. I mean, fear is natural to feel fear. You know, you're dealing with really sick people, and you could catch this virus, and you could die of COVID. Nobody wants to die. And then the fear is that you're going to catch the virus and take it home to your family. You may live with your elderly parents. You know, you may have a carer role at home. You pass it on to them.
Sure.
So, and that could lead to general anxiety symptoms. So it could really have devastating short-term and long-term mental health effects on staff.
Sure.
Fatigue, burnout, then depression, post-traumatic stress disorder even.
It's through the roof. And I think that where we didn't do well in mental health was to appreciate the physicality, the physical aspects of an individual. When we do care planning, it's very much heavily focused on what the person's experiencing, opposed to they're experiencing that in their body that might also have other problems associated with them. So I've seen many care plans. I used to review them for South West London and St. George's Trust, and very few at those times would have enough information to say, okay, fine, this person, because their mental health has an underlying health problem anyway. And this is the thing is, although it's might not be clearly apparent, the whole PPP, without proper training, it will go amiss, because in mental health, we're not being used to barrier nursing. We're not used to wearing that equipment. So it requires the matrons and all of that, those key members of the team to put in place robust training programs so that we start doing understanding how to use it. And also on top of that, asking those right questions so patients can be empowered to take better control of their health. Because again, if they're on wards, I've seen some wards whereby there's so many soft drinks, patients ordering takeaway with no real impetus to change their eating habits at all. Because at the end of the day, there's been no real push. Everything is about containing and then getting them out, opposed to let's really start applying and helping them to live a better, more safe life, better health, healthy diet, all those things that have not really been pushed. And I think that it's because of the drain, the brain drain, staff going elsewhere because of better.
Yeah, and as you know, patients with severe mental illness, for example, those with schizophrenia and bipolar, a typical patient that's being care coordinated by the NHS, they do badly physically.
Yeah.
So someone with schizophrenia will die 20 years younger, will live 20 years less compared to someone without schizophrenia. And 1 in 10 patients with schizophrenia commit suicide.
Yeah.
So they need quite specific healthcare needs.
Yeah.
They tend to suffer from obesity. They smoke a lot, more than sure. They take drugs and alcohol sometimes to treat their symptoms. So the one worry I have, and a lot of us have, is that COVID, coronavirus will affect them much more adversely, and it will.
Yeah.
Than the rest of the population. These are people who do badly anyway.
Exactly.
And they are more neglected and now under more pressure.
Yeah. In terms of future gazing, I know it's very early stages to future gaze as a situation, but coming post coronavirus, I should imagine what would you imagine a healthcare system look like now? As you quite rightfully explained, a holistic set of issues. How would that transcend? How would that affect the funding? How would it affect a typical ward? What would that look like in your estimation?
I mean, broadly speaking, I hope that as a society we will reflect on what's happening right now. And I hope that we become more caring, more compassionate, and more equal.
Yeah.
And I think NHS needs to take the lead on being the most caring organization out there.
Sure.
And you need funding for it. You need resources. You can't make something out of nothing.
No.
And we are in the caring profession, but we need the tools to provide that care. I mean, a lot of my colleagues are thinking quite negatively. They're worried about the long-term economic impact. It shouldn't be. I mean, if there's proper planning, if there's proper resources, if we don't have another round of austerity, but rather the opposite, investment, there shouldn't be the mental health consequences.
Exactly.
So we need that kind of better preparation.
Yeah.
And which includes into both primary and secondary care for mental health provision.
Yeah.
So a lot of mental health patients in the next few weeks and months will go to the GPs. And the GPs need to have tools. So we need more health professionals, not nurses, even psychiatrists in primary care to deal with that. And if they cannot be managed in primary care, and also psychologists and counselors to provide therapy, which is crucial, then they can be referred onto secondary services for more specialist input from a senior consultant or a senior psychologist and a nurse.
Sure.
So, yeah.
Yeah, no.
And again, I'm also an addiction specialist. It is known that people during the time of crisis and economic recession, they drink more. So I think we need to bring temporary or maybe even long-term measures in place to reduce that, similar to what's happening in Scotland by bringing in minimum price per unit, maybe 50 pence per unit, to make alcohol more accessible, less accessible and more expensive, to deal with the potential sort of alcohol-related pandemic that we may have because of coronavirus.
I totally agree.
So it's important to prepare for the secondary and tertiary consequences of what's happening right now. And
I would just add to that we all have a role to play in that. Even celebrities have a role to play in that. There was quite a few prominent celebrities that when the coronavirus and the lockdown was enforced, said, I'm stocking up on my alcohol. There are quite a few celebrities said that quite openly. I'm stocking up my alcohol because I'm stuck.
I mean, if you go to the alcohol aisle of Sainsbury's, I mean, there's hardly anything there.
I know. I know.
Toilet paper's gone and all the alcoholic drinks have gone as well.
I know. And drink is one of those things that can creep up on you. And it's one of those addictions that's very, very hard to fight. And I think in terms of what you're talking about, the future gazing of how the NHS needs to position itself, I think a lot of great work was taking place prior coronavirus, and hopefully that still continues in terms of integrated care models. Yeah, more joined up care between primary, secondary care, utilizing other services, pharmacies to get involved, schools.
We have the data.
Yeah,
we have policies, we have holistic care, we have the recovery model. So holistic care, everything has to be joined up.
Yes.
And we have recovery model, like what you said at the beginning. Patients have to learn to look after themselves. They have to have a meaningful life outside mental health services. You have some kind of employment.
Yeah.
So we know what we need to do, but we're not doing it. And unfortunately, it does come to poor planning, poor leadership, and inadequate resources.
100%.
As an example, they talk about joint health social care. And it's so important for psychiatry. A lot of our patients are poor. They need proper housing. And it's social services who deal with the housing side. Now, a few years ago, in our MDTs, in our multidisciplinary teams, we had social workers. And now, because they were not really meeting their targets and they were using different, it's red tape, it's NHS red tape. They were taken back to town halls. And so that's created a barrier between sort of health professionals, psychiatrists, nurses, psychologists, and social workers. And that kind of joint up care that everyone talks about is not happening because physically we're segregated.
Yeah.
And there's a barrier between us, and we have to make a referral to them. And there's a huge turnover of staff, both nurses and social workers. And so every time you contact them, there's somebody new. And it's just, and at the end of the day, we know what we need to do, but we're not doing it.
Yeah. And I would also say we go to the educational institutions. I do a lot of work with Kingston University in collaboration with South West London and St George's Trust, whereby we educate the nurses to prepare them for working in a multidisciplinary environment. And some of the teachings that we deliver to pre-reg nurses also go out to social workers, also go out to other healthcare professionals, dentists, and people in dentistry as well, psychology as well, and also midwives, because it's all about that. So, but when they do qualify, it's important that all those teachings reflect what they're actually going to do in practice, because it's all well and good, this is how you're going to work, but in the real world, your manager is not a social worker, and they subscribe to a different profession and as you, and you communicate on the lowest common denominator and have arguments sometimes or robust conversations about what is a care plan or a plan for care, because you're now on the semantic level of communication that breaks down because of different professional boundaries and all of those things. So I see the future whereby STPs, ICSs, and quite rightfully, as you pointed out, a lack of leadership. Because I sat in quite a few STP meetings, and I was thinking, what are the outputs? What are the outputs? What goals? What are the end? You can understand why they were merged into ICSs, so that people have very clear goals and strategies in place to achieve an outcome. Because quite frankly, I think we can move. Coronavirus has proven with the right stimulus or the right reason, health can move at a frighteningly fast pace. Look at the Queen, the Florence Nightingale Hospital, how quick that was put together. And that's including the EPR system, the beds in place, the equipment. We could do things at a frighteningly fast pace when Willie's there. Yeah. So, I think I'm looking forward to your next one in terms of the staffing and the effects on just to shine a light.
I'll try that later, and I will share it on social media, on my LinkedIn, and my also I'm on Twitter and I'm on Facebook as well. So I usually share those. Yeah,
cool. So if you can, I will share. Fantastic. I will share all those links on the podcast, and I would say thank you from the bottom of my heart for you spending the time to share with us your experiences regarding something that's an ongoing thing, but we can see that there's a deeper understanding, and we need to be mindful that we need to be mindful to pay attention to other aspects of this pandemic that are not directly health related, the byproducts of that, so that we could put safeguards in place to manage.
Indeed. Thank you so much for having me.
Thank you very much. Have a great day, sir. Take care.
You too, and look after yourself.
Okay.
Bye-bye.
Bye-bye.
Thank you for listening. Don't forget to check out micdropclub.com and get the show notes and useful links. Subscribe to the podcast. Don't just live life. Make life boom.